PRESLEY first broke yesterday when we learned she had been rushed to the hospital after experiencing a cardiac arrest. Joining us now is Dr. Zweibel with Hartford Healthcare with more about this. Now, thank you so much for being here. We appreciate it.
Sure. Thanks for having me.
Of course. Well, we don't know the cause of death for her at this point. We know she was hospitalized with cardiac arrest. Can you talk about that? What are the symptoms?
So typically people who have cardiac arrest, it's sudden. That's why we call it sudden cardiac death. Their hearts go into a very irregular rhythm that's just not compatible with life, and they collapse and lose consciousness.
And how precious are those moments when it first happens? How quickly do you need to get to that patient?
Yeah, so that is critically important to recognize that this has happened. We typically want people to activate the chain of survival, so calling 911 and immediately starting CPR. These are very critical moments in a patient's life. They say that there's a reduction in mortality of about 10% for every 1 minute that a patient is down with a cardiac arrest. So it's really, really important that patients, again, get immediate CPR and eventually have a defibrillator that's brought to their attention so this heart rhythm can be restored, back to normal.
Dr. Zweibel, we hear so much about cardiac arrest and then heart attack. What are the differences here?
Yeah, so a heart attack is when the heart muscle is not getting enough blood flow, typically from a blockage that occurs in an artery. That can lead to cardiac arrest, but I would say most patients who have cardiac arrest, it's not from an active heart attack. It may be that they've had a heart attack in the past and have scar tissue in their heart or some other reason why they may have an arrhythmia and then suffer a cardiac arrest.
And are some people predisposed to these kinds of issues?
Well, certainly there's some genetic issues that can cause cardiac arrest, and certainly patients are predisposed to having heart disease and heart attacks, which, as I said, could lead to cardiac arrest. And so typically it's important, again, most important to recognize that people are having a cardiac arrest and to immediately start the chain of survival, CPR, to get them rescued.
And those annual checkups are so important, too.
Yes.
Yes. All right. Dr. Zweibel with Hartford Healthcare, thank you so much for joining us this afternoon.
Sure. Thank you.